Hello, shalom, and welcome to another episode of Community Relations Corner, where we discuss issues of concern to New York's Jewish community and our friends and partners all over the New York metropolitan area. I'm your host, Michael Miller, the Executive Vice President and CEO of the Jewish Community Relations Council of New York, JCRC-NY. Despite the virtual background of Lower Manhattan, I am actually broadcasting from the state of Israel. And one of our guests as well is also here in the state of Israel. And one of our guests, I assume, is back in New York. But let me just say about our program today, we're going to be shifting our focus to international affairs, specifically the COVID crisis in India and efforts to aid India and assist the Indian people. We're happy to welcome two wonderful guests. Our first is Mr. Kamlesh Mehta, who is the publisher of the South Asian Times, the most widely read Indian American weekly newspaper, and it's been publishing since 2008. Welcome, Kamlesh. Thank you for joining us.
Namaste. Thank you. Shalom.
Right,
Thank
namaste,
you for inviting me.
namaste. Shalom. We're also joined by Mr. Yotam Polizer, who is the CEO of IsraAid, an international humanitarian aid organization based out of Israel that provides urgent aid and assists in the recovery of natural disasters all around the world. Shalom and welcome. Namaste, Yotam.
Namaste and shalom from Israel.
Thank you. Kamlesh, let me start with you. The world has seen some truly heartbreaking images of the Indian people struggling to deal with COVID-19. Officials cite reports that over 27 million cases of COVID have been identified and over 300,000 deaths, mostly over the last month, but some suggest that the figures are vastly underestimated, and there may be well over, believe it or not, 700 million cases and more than 1.2 million deaths, the highest in the world right now. Can you please give our viewers and us, Yotam and myself, an overview about the Indian COVID crisis, how it developed and how it compares to what we're seeing here in the United States?
Mr. Miller, what you said, that it may be underreported, I will not argue on that point. India is a very big country, small towns, rural places, large cities, and the COVID is now everywhere. After the second wave, it has really spread out all over the India. And the numbers what we are getting, it could be different. But what I read in New York Times also, and what you said right now, that it could be 700 million, I doubt on that number. That number is really a very big number. It means more than half the population is going through the COVID, and it doesn't sound correct. But definitely the numbers are maybe 2-3 times more than what we see because of the information. And in India, as we all know, that India is still a developing country. And if you want to compare with America and India, that won't be a apple to apple comparison. But all I can tell you that Indian population is almost 4 times than American population. The reported death are only 50 to 60% of the numbers we have in America. I have seen what has happened in New York, where I live, and Long Island, almost a year back. It was chaos all over. We have seen that there were no respect to the dead bodies. People were not going to take their relatives. There were no place for the funeral. We have seen that also. And same thing has happened in India. I'm not surprised when a country like America can face that kind of situation. India, with the limited resources, they can have that kind of situation also.
So can you tell Kamlesh, how has we referenced the second wave, how has the second wave been hitting the country differently than the first wave?
Oh my God, there is, I have no word to express what has been done in the second wave. I think India was caught uh, on the wrong point. They thought that the first wave is over, India is safe. They started, helping other countries. The Indian government, the practice of Indian government to handle the first wave was appreciated by all over the world. Even the WHO, they were following that. But the second wave came. It was, I would say, tsunami. The right word is tsunami. It came and it took over the whole India within few weeks. All of a sudden, there were no vaccine, there were no oxygens, there were no beds, there were not enough resources available to cure or take care of so many patients. The number of patients rose up to 400,000 people a day. That was really very bad. So there is no comparison. The first wave was handled very nicely. Second wave, it came all of a sudden. But I still admire the government of India. They did not lose the control. When there were shortages of oxygen, they created the resources of oxygen. They imported the oxygens from all over the world. Now they're talking about the vaccines, and I'm pretty sure within a week or so, India will be again have enough vaccines to save the population, the large population of India. But what damage has been made, that is terrible, can't express in 3 words.
My understanding, Kamlesh, let's just stick on this point. My understanding is that the spread of COVID was accelerated by people going to social events, cultural events, such as weddings. Where was this most prevalent, and why were COVID restrictions ignored?
There are many factors to it. First of all, the cultural part of India. The wedding is a major issue and a major event in the life. People invite their guests. Sometimes I have attended the weddings with more than 10,000 people in the reception, 7,000, 4,000, those kind of weddings also. But government of India was very careful. They put the restrictions, 50 people, 100 people, even less. But as I said, the culture is different. People took chances. They attended the weddings. They attended the religious functions, and they were careless. I would say that they thought that they are immune and they won't get the COVID. But COVID did not spare anybody, rich or poor, nobody is spared. So I would say the cultural part of India and lack of education also, and carelessness, that is also added fuel to the spread of COVID.
Now, what is the healthcare system in India, and what are the most significant healthcare disparities that have come to light during the course of this crisis?
Healthcare system compared to Western world, India is definitely lacking. But Indian doctors are very good. They know how to face the challenges, how to work under the crisis, and they have done a good job. But if you compare the per thousand or 10,000 people, India doesn't have one hospital for 10,000 people. So of course the infrastructure is weak. It is not as strong as what America has or what Europe has. But Indian doctors are very hardworking. They have taken this fight and they were successful in controlling. If we did not have these kind of doctors, I don't think that the numbers would be, maybe we would be talking about the right number, what you told earlier. But the doctors, I appreciate them. They are the really true warriors. With the limited resources, they did the great job.
Well, can you also explain for our viewers about migration patterns in India in the context of lockdowns across the country?
Yeah, it is very normal in India. I would say all over the world, any part. People go for the better life, more economic reasons. Like I came from India 35 years back, definitely for better life and better financial reasons. So they do it in India also. Rural people who are really, their income is less than $1 a day in small cities, they go to the large cities and they do different kind of work. They work as a laborer. They work as like, unskilled labor. Sometimes they don't have facility to live, but they keep working and finally they get their foothold and they find space in the big cities also. But these numbers are large numbers because India is a large population. Large numbers. When the first COVID came, everybody was terrified. There were lockdown. These people who did not have shelter, they lost their job and they wanted to go back to their home. They wanted to go to their parents. They wanted to go to their children. And the transportation were not that equipped. Many went back on their foot, on cycle, on rickshaw, or whatever the way they could go, they did. But now this second wave, things are different. It was not a major issue.
Yeah. The last question in this segment of the fact-finding part of the interview is government actions. What mandates did the government put into place, and what actions did the Indian government take to protect and provide for its people? You referenced it a few minutes ago, but the specific mandates that came down from government, can you please describe what they were?
One thing is very clear to me. This pandemic has left no household, big or small, untouched. Everyone is doing their level best to ease access to care. If you have heard about the Bhilwara model, in the first wave, it was very popular, but in the second wave, it was failed miserably. We could not do anything, and nobody predicted the second wave that the way it hit the country like a tsunami. It is a union of states, so each state will be independently reporting figures. They are working together to fight this out and to work together and find the solution together. That is a mandate of India government. The states and federal government are working together. And I have a strong feeling that in few weeks, India will control the second wave and life will be much normal than what we see right now.
Just again, for all of us, for our viewers in particular, how many states are there in India and what is the general population?
I think there are 29 states and there are some federal territories also, union territories also. And population is definitely above 1.3 billion.
100 billion.
Yeah.
All right. Thank you very much, Kamlesh. We'll get back to you in a moment. I want to turn to our other guest who's been sitting patiently, and that's Yotam. Can you tell us and our viewers about IsraAid, its mission, its strategy, and its particularly its community-based approach? Yotam?
Sure. Thank you, Michael. And thank you, Kamlesh, for giving us the overview. The situation is really overwhelming. I mean, I just want to open by saying that I've personally been in this work for now 14 years, including leading a lot of humanitarian missions during the Ebola, for example, in West Africa, following the tsunami in Japan. So I can really understand, you use the word tsunami to describe what's happening in India. The situation is so overwhelming and so devastating. and it feels like for an organization like IsraAid that whatever you do is like a drop in the bucket. In general, what we do, IsraAid, so we were established in 2001. We responded to crises and disasters in 55 countries. We currently have teams on the ground in 16 countries. And what we do is two things. One is provide immediate relief, emergency relief, whether it's medical support, provide people with access to clean water, trauma care, etc. And we're also focusing on long-term capacity building and resilience building for communities and governments in each of our countries of operation. In the case of COVID, we have been working, as I said, in 16 countries, and our focus is about access, providing people with access to hygiene and protection. In some countries, we are now focusing on access to vaccine because it's a huge gap, and we're trying to take the expertise and the models developed in Israel to these countries. So that's kind of in short. And in India, we actually worked there already in 2018 following the floods that they had in southern India, in Kerala and Karnataka state. So we sent Israeli water engineers and Israeli trauma specialists who trained many community members, social workers, and local engineers, and really helped thousands of people regain access to clean water and provided them with trauma counseling and care. So we have a lot of history in India, and we care for this place, and we love the Indian people. So when this second brutal wave, this tsunami devastated India, it was very clear for us that we have to respond. Do you want me to share about our response now, Michael, or maybe we can get to it later?
Yeah. No,
Yeah,
why
okay.
don't you share,
So-
and as well as, Israel is known as the startup nation. There's such tremendous creativity in the country. By the way, very similar to India. What did IsraAid bring to India that wasn't there?
So I think you're absolutely right about the startup nation. We really are trying to take this can-do approach, this the Israeli approach to find solution to difficult problems. So obviously the first gap that the whole world saw in India was really the lack of medical supplies in some of the hospitals, especially in the remote areas. So we partnered with a local organization called Gabriel Project, based out of Mumbai, and we provided medical care and supplies for 20 hospitals in a rural area called Palghar, which was really one of the worst affected areas, just outside of Mumbai. So we actually spoke and we partnered with the CEO of the district, with the head of the district and the district health officer, and they sent us a very comprehensive list of the things they really need in terms of medical supplies. And we are now providing these supplies. We already sent 2 shipments, and a very big shipment is arriving next week. So that's the first stage. The second stage, which we believe will start in a week or 2, is really to see how we can help with the long-term impact. And that will be helping with their public health and helping getting people with access to vaccine. And also helping the medical healthcare workers who are completely traumatized and are overwhelmed. And we're going to use, again, models from Israel. And unfortunately, as you all know, we have a lot of traumas in Israel. But thanks to these traumas, we actually developed very innovative tools and skills to help people cope with trauma. So we're going to take these tools and we're going to support Indian healthcare workers who, as Kamlesh mentioned, they are the real heroes. They are standing in the front line. They are protecting all of us in this terrible crisis. And we'll do the best we can to provide them with some support, self-care, and stress management.
Thank you. We're focusing on India, but just as a side note, are there any other countries that IsraAid is also assisting currently during the COVID crisis?
Yeah, I'm actually in all of our countries of operation. In many of them, we actually started because of a different crisis, whether it's, the hurricane in the Caribbean, or the volcano eruption in Guatemala, or the refugee crisis, the Syrian refugee crisis in Greece. All of these countries are now suffering from COVID. In some of them, the situation is really, really bad. So in all of these countries, we're responding to COVID through our access approach. So really providing with people to access to the best clinical care, access to vaccine. This is actually a very exciting project. Just recently, about 2 months ago, we were asked by the Minister of Health in a country called Eswatini, formerly Swaziland in Africa, just neighboring to South Africa. The Prime Minister actually died of COVID, and the Minister of Health reached out to us and asked if we can bring the expertise, the Israeli expertise, in the vaccination rollout campaign that we had here in Israel. And Israel is known to be the first vaccinated nation in the world. So we gathered a group of really Israeli top public health specialists, epidemiologists, a lot of people who were involved in the response here. and we send them to Eswatini, and we're now working side by side with the Ministry of Health and helping the whole country get vaccinated. So that could be the first country in Africa to be vaccinated. And in India, we're planning to do the same, but India is a bit bigger. You know, one district in India is about the size of Israel. So we're working on the district level in Palghar district, as I mentioned, which is really, a rural area just outside of Mumbai with an indigenous community. And we're going to do the same after this brutal wave is passed. We're going to focus on prevention and vaccination there.
And thank you. What has IsraAid learned and changed and developed during the course of COVID-19 response in comparison to dealing, let's say, with other natural disasters? This is as you would understand in some of our viewers, this is the Manishtana question. How is COVID-19 different than other disasters that you've dealt with?
In every single way, basically. Well, first of all, IsraAid is very famous to be first on the ground whenever there's a new disaster. I think that's one of our that's part of our DNA. We usually send a team from Israel in the first 72 hours after a disaster, no matter where it is. And I personally was in Japan 4 days after the tsunami, in Nepal after the earthquake in 2015. I was there 36 hours after. In the Ebola outbreak, in the refugee crisis, all over the world, we really send Israeli team. In the case of COVID, we couldn't travel because of all the travel restrictions. But I think our biggest asset and the reason we were able to respond and to reach over 9 million people in our COVID response globally was because we invested in the last few years in building the capacity of local teams. So out of our 430 staff globally, about 80% of them are local people that we trained over the last few years. And these are social workers, engineers, doctors, nurses, psychologists, you name it. And they were really in the front line of the crisis in each of our countries of operation. So from the Venezuelan refugee crisis in Colombia, to the volcano eruption in Guatemala, to a refugee camp in Kenya and Uganda, our teams were really focusing on providing people with access based on the gaps that we identified. In some places, it was really about, setting water taps because people really didn't have access to clean water. At the point where in Israel and the States, we didn't have enough masks, which was very concerning. In these parts of the world, they didn't have access to clean water. So, and they couldn't even wash their hands. In other parts of the world, we actually have a group of Syrian refugees who work with us in Greece and Germany, and they actually started a factory to produce masks. And these masks were distributed first to the refugee community and later to the general community. And one of the most moving stories I heard from our teams on the ground was when a group of Syrian refugees who are now working for IsraAid were distributing these masks to Holocaust survivors in Germany.
Right.
So in Germany of all places. So, it's an example of what I call post-traumatic growth, how a terrible crisis, a terrible disaster could turn into an opportunity, not only to save lives, but also to build bridges between people.
I'm so impressed, I always have been, by what IsraAid has done. I saw one of your projects, you talk about clean water before in Puerto Rico, after one of the disasters there was the hurricane before the earthquake. And it's really just extraordinary what IsraAid is accomplishing all around the world. I want to turn it now back to Kamlesh in regard to culture. Let's focus a little bit on culture. How have cultural nuances across India helped or hindered during the current crisis? You touched on it a little bit before. Let's go a little bit more in depth. Like, what are the cultural phenomena that we should be familiar with in regard to how India has been dealing with the COVID crisis?
First of all, my sincere thanks and gratitude to Mr. IsraAid for the IsraAid. Israel is a very dear friend of India, and we respect a lot. Even being a small country, less than 10 million people, but what they do is much more than the large countries are able to do. So my salute to Israel and to Mr. Yotam also.
Thank you.
And India, we all know, is a very diverse country. Diversities, language, food, religions. There are so much diversities there that to define the whole country in one way, it is very difficult. And people are very sensitive about their culture, what they have been doing, whether it is religion or their rights, or from, we can say, from life, from the birth to the death, they have their own way of living, and they don't want to digress or divert from their culture. And in a way, that has really impacted the COVID also. The religious ceremonies, the weddings, other rituals, it has been a reason to spread the COVID. And all I can tell you that it is very difficult to control the religious gathering and other gathering in India. It's not easy.
Yeah.
And culturally, because of those notion, for them, their culture is more important than anything else. Sometimes they become very careless. Yeah. It's very unfortunate, but this is the truth part.
And Yotam, you spent 3 years in Nepal. You have been in India after the floods a couple of years back. What can you share about local culture, and particularly the response to you as being from Israel? We just heard from Kamlesh how grateful he is for the role that Israel is playing, but does that also seep its way down to the grassroots? So whether you're in communities, that they are as grateful as Kamlesh has been.
Absolutely. I mean, first of all, I personally been to India maybe 20 times. We always talk about this trend of Israelis after the army, after the military service, traveling in India. It's always funny. There's about 50,000 Israelis who do it every year. I remember the first time I was in India, right after my military service, I spoke to a rickshaw, a tuk-tuk driver, and he asked me how many people live in Israel. At that time, we were about around 6-7 million. I told him we are about 7 million people. Say, how come 7 million? 2 million of Israelis are here in India. We first of all, we are, as Israelis have and we actually saw a lot of Israelis and Israeli companies stepping in now to support India, because really India is a warm place in our hearts. And I think it's mutual. I mean, anytime I visited in India, I received a very, very warm welcome. First as a backpacker in remote areas in India, and later meeting government officials, heads of companies, media-related people. It was always a very, very warm welcome. I think there's so much that we share, even though India is 1.3 billion and we are 9 million people. But the creativity, the innovative spirit, some of the challenges that we share in terms of some of the ongoing conflicts inside and outside of India, and the conflicts that we share here. So we really have so much shared experiences and know-how that we can benefit from each other. So I really do see it not as a one-sided project. It's a give and take. It's a cultural exchange, and that's why we really see us getting involved and providing support, not just in the short term, but really have a long-term partnership with our Indian partners.
Okay, thank you. I'm going to turn back to Kamlesh. Right behind Yotam is the logo of his organization, and the second half is the word aid. I understand from my team that there is a semantic dispute in India with regard to that term. Can you please just inform us? I'm curious as to what the issue is.
I can't go into more details. It can create some issues, but let me tell you one thing. First of all, I'm a diamond dealer. So I have been working with Israel and many Jewish people for the last 37 years. And that has helped me in making a better financial life of my family also. And Israel is very proactive in many ways, and we are very thankful for that. Israeli help, whether it's in the time of disaster or at any other time, we have always welcomed it. It came as like Israel is our brother. India and Israel is truly like brothers to each other. And a friend in need is a true friend indeed. We call Israel as a friend indeed. When time comes, India also help other countries. And if we get the help from our friends, we accept it from, with gratitude and wholeheartedly. And I would say that whatever help we get from Israel, it is well respected, and we receive it with the respect, and we thank you for them. We thank them for all their help at their end.
Thank you for that. I want to turn back to you, Kamlesh, and ask you, as a journalist, as the publisher of the South Asia Times, how difficult has it been? And by the way, our team in the chat has put the link to the South Asia Times if people want to take a look at it. It's in English language, of course. How difficult has it been to get accurate information to report in the newspaper? How do you know what information to trust, given the report, the vast underreporting of the COVID cases that we spoke of at the beginning of the conversation? And how has misinformation exacerbated the crisis in India?
All the newspapers in the world, small or big, they depend on the content from syndicates or from other countries and other people and other news agencies also. We also get the news, our team cannot be on the ground everywhere, every time. And of course, we work with only those news agencies or the media outlets who are reputable. They don't have any negative or yellow journalism reputation. So South Asian Times is known for that. We are award-winning newspaper. By the way, I'm not editor. My background is, as I said, a diamond dealer. But we started this newspaper in 2008, and I'm very happy to say that lately we are the largest Indian American newspaper in America. And as I said, India is a large country and is the largest democracy of the world also. The information comes from, it's like a pyramid system. It comes from the bottom, then it goes up and up. A rural area, they inform to their district level. District level, they inform to the states. States inform to the health ministry or the home ministry, and then the consolidated figures are declared in the media or to the community. Again, as we spoke earlier, that there may be some propaganda there, misconception, misinformation could be there. But at large, Indian media, which is considered the fourth pillar of the democracy, is very strong, very honest, and we respect that, and we trust them also.
Let me start with Yotam. I'm going to ask both of you this question. From both of your experience, Kamlesh being a native of India and Yotam spending so much time in the Far East, how long do you expect that this emergency in India is going to last? How long is it going to continue for? And what do you expect, or when do you expect this to turn around and for India to get the upper hand? Yotam?
Very good question. I think it really depends on the response. I heard the best case scenario and the worst case scenario. The worst case scenario is that we will exceed 1 million people dying of COVID in a few months' time in India, and that this wave will continue going through India and devastating for another 6 months. The better case scenario, which very much depends on medical support and obviously all the successful kind of lockdown and vaccination campaign, which is really the key, means that we will still have 100,000 or 200,000 more people dying from this wave, and probably 1 or 2 months of this ongoing devastation. But then we will start seeing a decrease in the cases and in the numbers.
So you think it'll be a matter of months rather than a matter of years?
Yeah, I think it will be a matter of months rather a matter of years. And I am optimistic that anyhow, India will be able to vaccinate big part of its population because they are actually producing the vaccine in India. I think getting the supply chain and will take a few months, but not years.
Right. And Kamlesh, what are your views on it? Do you agree, disagree?
No, I agree with him. I think next couple of weeks, I would say maximum 1 month, India will control the damage what we have seen in last 4 or 5 weeks. And it won't be the emergency kind of situation. And they will have enough vaccines, before India send vaccines out, because one of the motive is Vasudhaiva Kutumbakam. In our mind, the whole world is one family. So we supported the other part. We sent out more than 65 million vaccinations to the other countries. And now we feel the shortage in our country, but government of India has started procuring the vaccines from all over the world. And they think they are going to get more than 2 billion vaccines in next 6 months. And hopefully they will control the emergency in next 3-4 weeks. And
how bad has the delay in getting the Oxford AstraZeneca vaccine into India been? How damaging has that been to the efforts to recover?
No, it was horrible. India was not ready for the second wave the way it came. And no matter who, in any part of the world, if the way it happened in India, if it had happened any part of the world, they would have seen the same kind of disastrous situation. And Indian people are very fighters, the warriors. Mm-hmm. They can live under the crisis, and they have lived, and it has proven. If government of India was not so active, let's go back a little bit. When the COVID first came, India was not producing any mask or any PPE or anything. Within months, they become an exporter of those things. Then vaccine, India produced 2 vaccines and more in the way. Now we had the oxygen problem. Within 3 weeks, we got enough oxygen to supply everywhere. Now we are facing the vaccination. I'm pretty sure in next couple of weeks, India will import and produce enough vaccination that we won't see any kind of crisis. And they will be proactive to prepare for the third wave if there is any. So I have a lot of confidence on government of India. Nobody could do better job what they have done in this kind of crisis.
Thank you to both of you for that positive note. And it's a good way to end my part of the interview. But I'd love to give both of you an opportunity to say a few words after I thank you for a truly fascinating conversation. I've had many guests on Community Relations Corner, but this discussion has really been outstanding. Thank you very much. So I'll first turn back to you, Kamlesh, and any last word you'd like to share with our viewers?
First of all, thank you very much to you, Mr. Miller. You have been very humble and to the point. And I hope that our relationship, Israel and India relationship, is grow further and further. And whenever Israel needs any help, we will be there for them also. And thank you very much. Thank you, Mr. Porton. You are also very kind. And what you are doing for the humanitarian services all over the world, that's remarkably wonderful, and we appreciate that. And thanks again for the opportunity. Thank you. Namaskar.
Thank you. Yotam, please, last word.
So for me, as Kamlesh said, I think this terrible crisis and tsunami is also always an opportunity to really strengthen the partnership and the relationship between the people of India and the people of Israel. And I really hope that this terrible wave will end soon, and we can focus really on the partnership and the friendship between our two people and countries. And I look forward, Kamlesh, to hopefully meeting you in person and visiting India again in the near future, and to invite you to Israel. Thank you.
Please, you are most welcome. Be my guest in New York whenever you happen to be here. I don't know when I will go next time to India, but you are most welcome when I am there. I will keep in touch with you. Thank you very much.
Absolutely.
Hey, thanks to you very, very much to both of you. My thanks to our production team, executive producer Noam Gilboard, producer Rebecca Grossman, and technical expert Jennifer Glick for bringing us this program. This has truly been a meeting of the worlds. We have Kamlesh Mehta from India in New York, and we have Michael Miller from New York here in Israel, and Yotam Polizer from Israel in Israel, despite the fact that IsraAid, of course, is all around the world. Toda rabah, thank you very much. Namaste.
Thank you. Namaste, everyone. Thank you.
Shalom, and look forward to seeing everyone again on the next episode of Community Relations Corner. Goodbye to all. Thank you.
Bye-bye.
All the best to everyone. Thank you.